Practicing gratitude and resilience. Wow, we have a lot to be thankful for, and I've had the pleasure, the honor, and the sadness of working part time on weekends on a COVID ward, and there's some remarkable people uh, that have done amazing things. They're over 100 strong. They're a phenomenally great team, and one of the major things we want to say is just thank you so much. Next slide, please. It's just been a remarkable journey the last year with COVID plus. I think I'll be quiet. Let's see what we have to say. A special message from our volunteers, our staff. I think I have the world's best clinic, um, and the best people around me. So I just want to thanks to everybody.
On behalf of everyone at Dr. Kearney's clinic,
we would just like to say
thank you.
Thank you.
Thank you.
Thank you.
Thank you.
From our whole team of volunteers
to our staff here in the clinic,
we have seen how your courage
and compassion
has helped keep members of our community safe and well.
Dr. Kearney and everyone at the clinic has been touched and inspired
by the incredible staff at Hamilton General Hospital 5 West COVID Ward.
Really, we cannot help but feel the deepest sense of gratitude
for everything you've done
and continue to do for others.
You
have not backed down.
Instead, you have reminded us that there are so many incredible people
working in different capacities to help keep us healthy.
In recognition of healthcare workers everywhere.
And with a special shout out to those working at Hamilton General Hospital 5 West COVID Ward.
We thank you for being real-life superheroes.
As they say, fear can have two meanings.
You can forget everything and run,
or you can face everything and rise.
The path you have chosen is clear,
and it doesn't go unnoticed or unappreciated.
We cannot imagine how difficult these times have been for you, but you have given us a sense of hope and optimism.
We wouldn't be where we are now without you.
Thank you.
Thank you.
Thank you.
Thank you.
I just want to say thanks to each and every one of you for your support and going out of your way. We can't make this without you, without everybody's effort. Anyway, and everybody's understanding, because everybody's in a different situation, different locations, and everything's understanding. That's basically what we have to do, give and take.
I'm standing in my office waiting room. It's empty. At one time it was very busy, and COVID has had many changes. I learned so much, and one of the things I learned is about teamwork. Our office has 100 people strong, from our students to our McMaster volunteers to my staff, and special thanks for all they've done. But also thanks to you, the ward, the team, and MASH unit. I became a doctor because of the surgical movie show MASH, Mobile Army Surgical Hospital. 5 West is one of those MASH units, and it's a remarkable place. I feel privileged to spend some time there. I still can't type, and the ward clerk just types for me. You guys remind me how to be a doctor in the Hamilton Health Science places, and I appreciate that. Choices. You can't do it all, and you chose to be here. And thank you for letting me be part of your team intermittently. I feel bad that many of our families have sacrificed, and my wife and my kids. I've been a bad dad, I've been a bad husband, but I've been a better doctor because they give me the ability to be here. So we all made sacrifices, and you've made so many sacrifices, and keep doing what you're doing, and you do something very special. Resilience, I don't know what that means, but you've shown that in spades. Some days we can save the world, and some days we just have to go and cry. But you've done it together, and every part of society has paid a huge price. I hope we've all learned a lot, and I certainly have learned a lot, and probably a year of growth, and you've helped me grow, and thank you for the opportunity to serve. The people there are magnificent. The fact that you're there, thank you. You heard that word over and over again. I don't know how else to say, but thank you. And things will change, and I've learned so much, and you guys have made such a difference, and a small token of our appreciation. Keep doing what you're doing. There are times you'll be tired, but there'll be times where you should feel proud of what you've done. You've done a great job.
I want to cry. And great job, guys and ladies. You guys put this together beautifully, and I'm looking forward to hearing more. Soya, tell us what's happening next.
Okay, perfect. So thank you so much, everyone, for joining us today. We really wanted to dedicate this webinar to all of the healthcare workers, patients, and staff that have been putting their life on the line for us every day. And so this is just an overview of what we're going to be talking about today. We have some COVID-19 stories and perspectives from our patients and healthcare workers. We're going to talk a little bit about making advanced directives and how to keep you and your family safe. And then we'll dive into palliative care, looking at frailty and longevity. We'll talk a little bit about building resilience and gratitude and what that looks like. And then we'll end off with some COVID-19 vaccine updates. Okay, so first we're going to be diving into COVID-19 stories, patient and healthcare staff perspectives. So we're really lucky to have Lisa joining us here today. I believe she's on the call, and she will be sharing her COVID-19 story.
Hello to everyone. My name is Lisa Partito. Last October 14th, 2020, my dad, who was also a patient of Dr. Kernu's, was admitted into 5 West at the general site. The staff is incredible, was incredible, especially I'd like to mention Dr. Harper, who was just outstanding. He was really, truly cared about his patients and cared about their families as well. Every morning he would call me at about 10 a.m. and give me an update as to how dad was doing and whatnot. The nurses, everybody, the doctors, nurses, staff, everybody was exceptional. They made things a lot easier for myself, my sister, and my mom. Unfortunately, Dr. Harper called me on Saturday, October 18th at 10 a.m. as usual, and he gave me some bad news that dad was going into ICU South. He was moved into ICU, and at which time his condition just deteriorated. On Tuesday, October 20th, he passed. In ICU, he was under the care of Dr. Freitag and Nurse Tatiana, again, 2 exceptional, compassionate, understanding people. When the decision was made on October 20th to release the oxygen, Dr. Freitag had said to my mom, take your time, and nobody's in a rush. It won't be long. You let me know when you're ready. And my mom said, okay, do it now. And within 10 minutes, dad passed. He passed very peacefully. He looked like he was sleeping. But if it wasn't for the staff, like I said, the doctors, nurses, staff, everybody was fabulous. Can't ask for better people. You know, people are quick to complain and everything, but until you actually see it and you're there, you have no idea how hard people are working and what they're doing for others to keep trying to save lives and keep people healthy. Thank you to everyone.
Lisa, thank you for sharing those thoughts. And your dad was a great man. COVID has robbed too many of us. And why don't you mention who else in the family got COVID?
How it had happened, how we all got COVID. Mom, Jeanette, my sister Andrea, and myself. I had contracted COVID at work, not knowing. I brought it into the house, and I felt a little bit off. Like I thought it was change of season. It was, I think October 1st, 2nd, I was sneezing in that and felt like I was congested. And I thought it was just the change of the season. Well, it turned out, I found out coworker had tested positive, and I said, okay, this isn't weather related. It's got to be COVID. So I went for testing. Sure enough, it came back positive. A couple days later, mom started. It sounded like she had bronchitis. She called her family doctor, family physician, and she told her to get to the hospital and get a chest x-ray. And dad had a little bit of a dry cough like I did, but nothing to be concerned about or whatnot. So we said to him, you're going to the hospital, get tested as well. And he said, no, I'm fine. No need for that. And we're like, no, mom's going, you're going. Anyway, they both went to the Dravinsky hospital. They both got tested. Sure enough, they both came back positive. Mom tended to get a little bit worse. Her cough was really hoarse and whatnot. Dad was still good. And then it was October 14th at 3 a.m. He said, my chest feels a little heavy. I want to go to the hospital. And never would he have said he ever wanted to go to the hospital. We were like, you sure? Yep, I want to go to the hospital. Okay, so we called 911. Of course, they wouldn't let me go. I was prepared to go with them. They wouldn't let me go. And off he went to the hospital. Who would have ever thought that there was no return for him to come home? Never in a million years did that ever cross our mind. He was doing good. On the Friday, Dr. Harper said to me, Lisa, we're going to send him home. He's just a little unsteady on his feet, a little weak still. He's got stairs at home. So we're going to keep him over the weekend till he gets stronger, Saturday or Sunday. And I said, that's fine. And he looked at Dad and he said, Joe, are you willing to stay a couple more days? My dad said, no problem. He was up walking around in that area that they had at the time. There was a room that could hold 8 COVID patients. And at the time, there was 3 of them in the room. So we agreed to it. Everything was good. He was on no machines, no hookups, no nothing that day. And then I went back the Friday night. And still it was good. And Saturday morning, like I said, Dr. Harper called and said things have changed. He's on almost 50% oxygen, and he has to go into ICU because if we have to increase the oxygen, we can't do it on 5 West. I said, okay, I was surprised. Like I didn't know what to do. I didn't know how to react. So after the hospital I went, and unfortunately my mom and my sister couldn't join me because they were not released from public health as well. So they were at home. And I went down to the hospital and I went into ICU and Dad saw me and it's exactly like what you see on TV. You can only look through the glass, and he was waving me in, which will always be vivid in my mind, and it broke my heart. And I kept shaking my head like, no. And then I said to the doctor at the time, I said, I think it's best I leave for him and for myself. So I went home and yeah, and then it was just like overnight, his condition just worsened. That night he was still on oxygen about 60%. And then by Sunday night, they said to me, he's on 80. And I thought, wow, doing the math here, it doesn't look good, does it? And Monday they called us, but because of our situation, Mom and Andrea hadn't been released from public health. They said that they would be able to hold off. He was on 100% oxygen. And we said to Dr. Freitag, I said to him, and my sister spoke to him as well, we said, if he's suffering, please release him. We don't want to be holding him for our selfishness. And Dr. Freitag assured us that he wasn't suffering. So Tuesday, we went down to the hospital, and like I said, it was 10 minutes. They released the oxygen at 219, and at 229, we watched the monitor, and that was it. It's just, yeah, for people who don't believe in COVID and whatnot, I don't know. And the staff, like I said, the staff, everybody, they're drained, they're exhausted, yet they keep going. It's almost like their gas tank never goes on empty. And we got to really be appreciative and thankful for these people. Thankful for the country we live in as well.
Thank you, Lisa, for sharing that story. And we all struggle about COVID. And some people, it's totally asymptomatic, and some people have a terrible course from this. And your dad was a great man. He did have Parkinson's disease, and he did have heart disease, and he was older, so that put him in a higher risk category. But as I keep telling you, is that's nobody's fault, and you have a wonderful family, and you can see how contagious this is. So you can look at the facts of isolation, mask wearing, all these procedures. They make a difference. And
yes,
I feel bad for the government trying to balance the needs of one versus the needs of many, and it's a tough balance. So You did everything in your possible power, and everybody did a wonderful job looking after yourselves and your dad, and he will be remembered. He was a great guy. Thank you so much for
Thank you.
sharing your story.
Thank you. My honor. I'm glad to be here tonight.
Let's go to the next slide, please. Oh, I just want to cry some days. So I have Rami here in front of me. Rami's I'm a pleasure to have my office next to a Shoppers Drug Mart here on Cannon Street. And when I said to Rami we wanted to do something special to thank all the staff on 5 West, they're 100 strong, and Rami came up and helped out. And in your bags you have a gift card from Rami and his team there. I love that team. We're also vaccinating too as well, and special thanks on my part is that I got my first vaccine at across the street from Hamilton General Hospital, and because of being involved with high-risk people and being on the COVID ward at times, I was fortunate enough to get my second vaccine. I was on basically 3 lists, and after one of my shifts actually on the COVID ward, I just saw Rami in the parking lot, and he vaccinated me that night. So thank you. Do you want to say a word, Rami, to everybody?
Well, I'm glad to be on this webinar. As usual, I always learn from these webinars more than what I think I pass as a message, and the passionate that Dr. Cornu has with his team for his patients is something to look always high at. I'm glad that I know how challenging it is for everybody, patients, healthcare workers, and even anybody working in the front line, regardless of what position they have. And it's great to see a doctor as Dr. Kurnu saying and seeing how many people behind the scenes are not known, and it's just a very nice gesture to say thank you. And I'm sure that whatever we're going through, we are all going through this together. Hopefully we'll go back to our normal life soon. And again, I'm always ready to be I'm a proud member of Hamiltonian community and healthcare community, and I will always try my best to accommodate and say thank you to all those who made it successful. I will, at least it's a very bumpy road, and apparently the road, and apparently we're all going through rough times. And I'm sorry for those who lost their beloved ones, and I hope that their memories will stay forever. And Dr. Cornu and the team has been doing a great job in reaching out to patients, even in the toughest situations. So thank you for having me on today.
Well, he's actually tested me a few times when I needed to be tested, and not just a good colleague, but a good friend, and the whole crew down at Shoppers Drug Mart are fantastic. So I thank them. You can see that we all have our different bubbles and teams, and to make all this work, you need multiple teams, and great teams. So we thank you. Next slide, please. I'm here in the office, and we're talking with the team that's doing the Emperor Preserved Congestive Heart Failure, and we're going through our audits. So we're very privileged to still be able to work and do our best jobs. And I just want to say a special thanks. And who are you guys?
So my name is Connor. I'm the study coordinator.
And who are you?
I'm Lee Mai. I'm the clinical research associate.
So we've been privileged to participate in clinical trials. This one is the Emperor Preserved, and on behalf of everybody on the team, thank you all in the COVID work for your hard work.
Thank you. Thank you very much.
Thank you very much.
You know, there's multiple teams, and doing big trials are important, and this is a big trial, an important trial. And so when Connor approached me to do this, our model was go big or go home. So we went big, and I think we're the leading recruiter site in Canada for this particular trial. But it's been, again, a great learning experience. And to do a big clinical trial during COVID is a challenge, but Connor and the team has done a wonderful job, and we all thank everybody for their hard work. Next slide, please.
I'm here.
So these are the names of all of the staff working on the 5 West ward. And so we just wanted to honor them and say thank you for all of the work that they've been doing and continue to do for us. We can just see a couple of photos here of them hard at work, but we just wanted to say a sincere thank you. And we have some more photos here from the team, and Dr. Kernew and our team put together a nice little letter to say thank you. And then I know Jen and other staff members at the clinic have put together little gift baskets for all of the healthcare workers there. So once again, we just wanted to say thank you so much. These are the faces behind what's keeping us safe out there. So we just wanted to say thank you so much for everything that you are doing for us.
This is a 7-day-a-week, 24-hour job on your. If you can just back one track, go back one slide there. This is coming in the morning. Can you back one slide there by any chance? Is that possible? Or if we have our resident doctor still wide awake after being awake for 24 hours and giving me a handover, and there's our nurses helping out, and great team. And on the top is Elizabeth. Elizabeth is a retired head nurse, and she had a stroke during COVID, and she surprised me and came to the clinic and brought some soup in, and you can see the resilience of so many people. A truly remarkable team of people, and thank you all for your dedication. You should feel proud of what you chose to do. You chose to be there.
You know, I learned a long time ago is that healthcare people do extraordinary things. It's scary being on a COVID ward. You've been here for less than a week, and what I see is that a young individual that is making such a big difference. What's it like to be in a new place? And where I see that many of the patients I see in practice are isolating themselves, and my quality of life is improved by being outside, exercising safely. And what's it like your experience here? So don't be afraid. There's wonderful people to help. Don't do silly things. And tell me your experience.
So yeah, like you said, I've only been here a few days, probably about a week. Coming onto the floor, I wasn't really that nervous. I've dealt with COVID patients before, and just by following proper protocols and donning and doffing appropriately, I was able to stay COVID free. So I just, I came here and I had the same mindset, like I'm just gonna come in, follow proper PPE, follow proper protocols, and hopefully I remain COVID free.
Thank you for all you've done.
Thank you.
I'm here with Carol on 5 West. I call this an amazing place where amazing people have done amazing work. Tell us a little bit how this crew is being held together, and tell me about this crew.
So I started supporting 5 West in July of last year until about January of 2021. This is an amazing group of individuals who have stepped up and had such tenacity as they went through managing all the changes and acclimatizing themselves with the different types of procedures that they needed to do in order to provide the care they wanted or the COVID patients needed. This is an amazing team, and I was really privileged to be able to help them and support them during that time.
There are so many stories, and we have a whole bunch more I'd like to share at some point in time, but again, every time you walk around this place, you see greatness. Thank you. Next slide, please.
I'm here.
So we are just a few community people over here. There's Springer's Meet Walter and his lovely wife, and then our colleagues here at Mr. Subway. Um, uh, they've all been through changes, but they want to take the time and say thank you, and they put a little something in the gift bag for you too as well. Just thank you for all you've done.
Go ahead.
No, you talk. You're the man. Go you.
Say something. Stop it right now. You know.
Okay. Do we have to say our names or anything or whatever?
Whatever you'd like to say.
No?
Hi, I'm Walter. This is Manuela, my daughter, and we would like to say thank you to all the nurses for the hard work. They're going through this period, and I hope you enjoy the little gift from Springer's Meat. Thank you.
Thank you.
Thank you, frontline workers, for all your hard work. We really appreciate that you're working hard in this situation.
I love what what everybody's done, and just thank you. Next slide, please. So, walking through a COVID ward, you learn a lot about people. And one of the things is that how to make good decisions at the right time and making your thoughts known. So I'm going to let Zoya start to talk about this, and we'll go from there.
Perfect. So actually part of my team has put together really great slides to help break it down in terms of what advanced directives are and why they're super important. So take it away, team.
Yeah, so we will be discussing advanced directives now. And advanced directives are a way for someone to give instructions and communicate their wishes now so that their values can be respected if they are no longer able to make decisions for themselves later on in life. And we acknowledge this can be a very difficult topic, and having these kinds of conversations with loved ones can be a very challenging thing to do. However, making advanced directives and having these conversations is also incredibly important because it makes things easier for everyone. It makes things easier for you because you know that your wishes are going to be followed in the future. It reduces stress on your loved ones because they know they will be doing what you would have wanted, and also reduces conflict among your loved ones. And it also helps healthcare providers make efficient and certain decisions regarding your care. So in general, advanced directives just eases the burdens for everyone involved in the process. Next slide, please. Yeah, so now that we've discussed the importance of advanced directives, we can discuss some of the details involved in the process. So advanced directives are essentially just a way for you to express your wishes regarding your care decisions, and you can include any of your care decisions in advanced directives. So these include where you want to live, what you want to eat and where, and what kind of healthcare you want. However, there are some important considerations that you should probably make during when you make your advanced directives. These include the possible or the likely decisions that your substitute decision maker will encounter. This can include whether or not you want to be resuscitated, whether or not you want to go on a ventilator, or receive artificial nutrition or hydration. But obviously, there's no way for you to possibly tell all the possible decisions that your substitute decision maker will encounter. So it's also important to communicate your values and your beliefs. And it's also helpful to discuss the outcomes that you're most fearful of, or the outcomes you most want to avoid, and the outcomes that you most hope for, so that your substitute decision maker can use these to guide their decisions. You can also, as you experience new things, you might change your mind about certain decisions, and it's always important to update your advanced directives as these change. And so you can make advanced directives in a number of ways. You can have a face-to-face discussion with your substitute decision maker. You can record yourself in terms using a video recording or a voice recording, and you can also have it in a written document. You may also choose to include it in a legal document known as the, next slide please. power of attorney of personal care. So this essentially is a legal document to appoint somebody to make decisions on your behalf. And you can appoint more than one person to help make these decisions for you in the future. And if you don't choose to fill in this document, then a healthcare provider will just go down a list of defined substitute decision makers by the law. And that starts with a spouse or common law partners, and it goes next to children and down a list of relatives. So again, you can include advance directives as part of this document, but this document has certain requirements that have to be met. So it needs to be in writing, it needs to be signed and dated, and it needs to be witnessed by 2 other people. There's no special form or template that's necessary, but there is one available at the Attorney General's website. Next slide, please. So finally, although advance directives and power of attorney personal care documents can make your wishes known, they are not medical orders, which means in emergencies, emergency personnel don't have them on hand and can't follow them. Those documents are usually reviewed by healthcare providers later on in the process. So for those with serious advanced illness, there is a form known as the physician-ordered scope of treatment or post. And the emergency personnel can follow this. This is a standard medical order to be completed with discussion with a healthcare professional. And while advance directives and power of attorney documents are not standardized and are usually very general, this document specifies specific treatments that people may or may not want. And I don't know if Dr. Kernew has more to say about this specific document.
Yeah, so I think it's always a challenge to talk about how you're going to end your life. But it's really important to make your wishes known. It's one of the things we don't really want to talk about, but it's something really important because, you know, some of us have some wishes that no matter what, we want to be kept alive at all costs. That's very few people. Many people want to, you know, ideally not wake up and die in their sleep, and most of us want to die at home if we could, with our loved ones around us. That's not always possible. And right now is that what COVID has done is it accelerates certain processes. And currently, for instance, I have about 10 people that in my practice that are passing away at home with the love and support of palliative care, their families, and supports like myself. But it's really important that you make your wishes known. What's best for you is that a good example, when my mother-in-law passed away, she had cancer, and we were able to have her pass away at home. My wife, who's a nurse, was able to look after her. I had took some time off to be there as much as I could, but like usual, my wife does all the work at home and keeps us sane and there. And my mother-in-law actually wrote her own eulogy. She was dying of cancer, and now is that you have a choice to make your wishes known. So if you don't want something done or you want something done, have different discussions. Now, the nitty-gritty about machines, how the details, just talk with your doctors, your friends, and I'll share that, is that there are times where, you know, having a non-painful death is now easier to do. I really think all of us need to look into their scope, into their eyes, into their souls, and see what they would like done. And so my plea to everybody is to think about this. You know, my financial advisor, whatever, says don't die without a will. As a healthcare provider, I said don't die without an advance directive on make your wishes known. You don't have to write them down. I'm not a lawyer, but I'd like to know what your wishes are. And I've had lots of discussions with my patients, and it's also okay to ask your doctors and your loved ones. Is that Dr. J, Dr. C, if you were in my position, what some of the things you'd be asking? What would you want or not be afraid to ask? And really important to bring that out. So thank you for sharing that. This happens to be the form at the Hamilton General Hospital that we use. You can be as specific as you need to be, but very importantly is that the people around you the doctors around you will help with that if you like. But it all starts off with your wishes and make them known. Thank you. Next slide, please. Now, this is a very interesting slide. Has three things. First of all, on the right is 30 Days to Healthier You. Now, I'm the world's biggest procrastinator. I've been writing this book for 25 years, and Zoya, who's going to be starting medical school, and this fall, congratulations, Zoya! I'm so proud of you, and well done, and a special plan for that.
Thank you.
And she actually did this cover, and I think we did this cover 5,000 times, and at the book, and this is the work of about 500 people. It has been written many times, and I remember, now Steve Jobs is a genius. I'm just a schmuck, and Steve Jobs couldn't figure out how his colors of white. It took us about, I don't know, these colors are green. We argued about this for I don't know how long, and we kept changing the covers. So, but what this book does, it tells a story about health and how to be healthier, and it does it 30 days at a time, and it's meant to be repeated over and over again. And it's really a book I'm very proud of because it allows people to explore different areas and to be healthier. And more importantly is that every penny collected to this goes to help others. So right now we're in a fortunate position in Canada. We have more vaccines than other countries. So all the sales of this book right now, 100% of it will go to basically buying vaccines for other countries, probably Africa, most likely. I have a relationship with some African countries, so but other things as well. On the left is a wonderful book called Being Mortal. I think this is a must-read for everybody. Reminds us is that modern medicine has done remarkable things. It's kept us alive, but also towards the end of our lives, we develop fragility. We're frail, and we can linger on and suffer. And what I learned is reading this book is that by the age of 80, we lost 40% of our factual recall, our ability to multitask. And so as I get older, my brain's getting slower and my hard drive is getting smaller. But I'm also getting more frail, and there's certain ways you can do to do that. So the book 30 Days tells you how to be strong. The book on the left, which is a national bestseller, tells us how to think about and our end-of-life care. In the middle is basically from Ocean Outfitters. This is an organization in BC that promotes outdoor activity. One of the things is that my encouragement is that part of my resilient package is to find ways to walk, to exercise, to be outside. And having a water bottle is something that I encourage everybody. We have to worry about the planet. Our generation has ruined this planet. We need to be more attentive to the environment as well. So my plea is to find ways to be healthier, to help others, and also when our time is coming is how to end our life. I have the pleasure of seeing so many people have a better death, and no one likes to die, but we can make that better. The team on 5 West has helped so many people get better, get over the COVID, and also have helped people end their lives. And COVID made a big challenge, as Lisa has told you, is that you can't be with the ones you love as easily, and that's been a bad situation. So first is congratulations, Zoya, on your new pathway, and to the team on 5 West for helping us either get better, be there when we need you, and also provide comfort at the right time. Thank you. Next slide, please. Oh, one more thing. Go back, I forgot. One of my heroes is Steve Jobs. And we'll put a link to his commensal speech, I think for Stanford, if I remember correctly, but basically it goes something like this: is if you spend too many days not enjoying what you're doing, do something else. Also, he also mentions that we're all connected to our past and things that happened will happen again, and we know how to make them link and things of nature as well. So um, remarkable people out there that to learn from. I know my son hates reading. I love reading, and you can learn a lot from books and stories. And so I encourage you to look at that speech by Steve Jobs. Next slide, please.
Yeah, so Dr. Could, you mentioned that a big part of understanding and kind of engaging in your own healthcare is really making your wishes known. And in order to do that, I think it's really important to know what kind of options are out there. So that's why we're going to talk about palliative care. So palliative care, next slide. Palliative care is a form of end-of-life care that's often provided to patients who might have more severe illnesses or uncontrolled symptoms, or even those who are expressing just a readiness to discuss palliative care and end-of-life care. So I just wanted to clear up what palliative care is and what it isn't. So it is meant to focus on improving the quality of life and the symptoms specifically for the betterment of the patients as well as their family. And it actually is an option at any stage of treatment. So you don't have to be deemed, that that there's no further treatment available, but it can be just your own willingness of, I really want to, I don't want to do this specific treatment because it's going to affect my quality of life, or it's going to be very painful, or the recovery is going to be very long. At any point, you can always bring this up to your physician or to your provider and start discussing this. It's always an option. So making use of that is important. Palliative care is not a doctor giving up on their patient or their needs. So we will always do what's best for you, but at certain points, based on, I guess, how severe your illness, or as I mentioned, the symptoms later on, it might be beneficial to, withhold the treatment, as the further curative procedures might not be actually helpful in furthering your lifespan. So it might be more important to enjoy the time that you have with less pain and less intervention. And it's important to note it's not giving up on yourself. A lot of people think that if we, forego care, that we're not taking everything we can to live. But it's really not that. It's our own decision and something that we should come to on our own. We can ask our family for their opinions and for all of that, but ultimately we should do what's right for us. And here's just some of the data that actually supports this idea that palliative care isn't really giving up or leading to any of your leading to a shorter lifespan. In fact, studies have shown that compared to standard care, people who received early palliative care, as you can see on the bottom left, they actually had a better quality of life for the rest of their lifespan after they stopped treatment. And in the middle, you can see there's lower rates of depression in people who engaged in early palliative care. And on the right, you can actually see that survival rates, interestingly enough, were longer in those that decided to engage in palliative care. So understanding your options is really important, and making an informed decision and taking time to consider the different outcomes is a very important thing when you're talking about end-of-life care. Next slide. So there are different ways to predict on how palliative care might help you, and a lot of these you can make yourself. But with regards to doctors in general and hospitals and how they deal with palliative care and recommendations for that is a tool you can see on the left. It's called MHOMR. And what this does is it will test kind of your risk for morbidity based on age, sex, and different factors that are coming in. And based on this, a doctor might be prompted to discuss an end-of-life care with you, so you can make an informed decision. But again, as I mentioned at all stages, if you don't want to wait for your provider to start the conversation with you, you can always go to your physician and start that conversation on your end. And even if you're not engaging in it now, you can always talk about it, get a better idea, so that way you can make a decision. And like Dong mentioned, create those advanced directives ahead of time. Now we're just going to take a little time to talk about how palliative care might look in the COVID-19 era. And as I'm sure Dr. Kearney will attest to later on, this is a lot of changes have been occurring in all forms of healthcare due to COVID-19. COVID-19 negative palliative care is still relatively similar in that you can, if you've chosen an early palliative care and you've tested COVID negative, you can stay at home with your family if you choose to, and there will still be provider support checking in, managing those symptoms, so that way you can have an improved quality of life. But the difference is some of these will be a mix of virtual and some of them will be in-person appointments. So that's just a way that we can satisfy the COVID-19 restrictions in that sense. For those who are, infected with COVID-19 or maybe COVID-19 is the reason that they are hospitalized, it becomes a little bit more difficult. And the healthcare workers, including those at 5 West, have been amazing and have done really their best to try and help people, interact with their loved ones who are ill. So what a lot of them will do is they will provide clear and frequent information on the COVID-19 patients and their condition, also their comfort and the level of care that they're receiving. And Lisa mentioned before that she received updates at 10 a.m. from the wonderful doctors at 5 West, and that's something that healthcare workers are bending over backwards and trying to do their best so that way people can say goodbyes, whether it be over phone or video, if the in-person is no longer allowed. So these are types of things that, although it's more difficult, we do try our best to allow for these palliative care and end-of-life conversations. And I just wanted to bring your attention right back to the goals of care discussion and the advanced directives, just so that way, in the event that you do find yourself in these situations, it's important to have others know how you would like to be treated and your wishes for treatment and care. I'll pass it over to Dr. Kearney if he has anything else he'd like to mention.
Now, I'm not trying to make this a morbid discussion. I want to make this a positive discussion. So to me is that I want to know how to celebrate people's lives. So the rules keep changing, and you can visit patients with COVID in the hospital under certain circumstances, and there's different protocols put in place to that depending on the oxygen level where you are, and so what I find remarkable it's an amazing place that you get to discuss things that you normally don't talk about, but also you get to share wonderful stories. So lots of stories were shared on that. Next slide, please. Next slide, please. So fragility, longevity, this is actually a neat slide here. This is something that I won't spend too much time right here, but you can actually look where you are if you are 1 to 9. Anybody want to mention a couple words about that? I don't want to spend too much time dwelling on this, but I just want to mention this is that sometimes many of us want care. We want things that we just can't give you. So I think it's important to speak to people who can provide information. And also, so you mentioned what your goals are, and the healthcare team will tell you what's realistic or not. One of the things that I find very challenging, very hard, and very brings down my morale, and is that when I see people that want more than we can deliver, and we have the potential for causing suffering, and we don't want to do that. So listen attentively to the people around you, and these are some of the tools that you can look at on your own to help about that. Does anybody else want to say anything about this slide? Okay, I think this slide just speaks volumes by looking at the pictures. Next slide, please. Now, this is now enough of the bad stuff, but it's not so bad. So to me is that The way I want to end my life is that if all goes well, on my 100th birthday, I'll drop dead after seeing my last patient in the office, and I'll be with my family and we'll celebrate that. But I don't know how it's going to be. But I do know how to make yourself live longer and better. The Harvard longevity study. Who's going to tell us about that?
So hi, I will be talking about the Harvard longevity study. So an article on Harvard Health shows that strengthening social relationship is an essential part of both your mental and physical health. It's important in your daily life as adequate sleep or a good diet. So one study claims that out of 309,000 people, lack of strong relationships increase the risk of premature death by 50%, which is quite a large number. So what makes relationships critical to our health? The most important thing that it does is that it helps release our stress. And it does this by releasing stress-reducing hormones. So stress can have a bunch of adverse effects on our health and our bodies, including affecting our coronary arteries, our gut function, our insulin regulation, and other immune system responses. And other studies show that women in satisfying marriages have lower risk of cardiovascular diseases, and a Swedish study found that people over the ages of 75 were at lower risk of dementia if they had strong social relationships in their life. And the good thing about forming these very strong social relationships is that it benefits not only the receiver of the attention, but also the giver, which is a nice little bonus. So some of the tips that the article mentions for forming these social relationships is first and foremost to focus on the quality of the relationships that you are forming. As the saying goes, quality over quantity. Focus on the relationships that mean the most to you. This could be friends, family, significant other, and what you do for them doesn't have to be extravagant. Something as simple as offering your help or showing signs of affections can do just as much. The other tip that they say is choose to do activities together that bring you joy. If you have something that you normally do by yourself or you have something that you want to do, bring others along to do it with you. Communicate with them and do something together that you'll enjoy. Some simple ideas are, going for a walk, having a picnic, having a group movie, or some creative ideas are maybe trying to draw portraits of each other, writing handwritten letters, and cooking together. And the most important thing is that you're spending time with them. What you do doesn't have to be exciting, and you shouldn't try to force yourself to please the other person. And the activity that you do together should allow you to enjoy each other's company. And the third one is something I know a lot of people find have trouble with doing, and I personally find that I have trouble with doing, is delegating tasks to others and trying not to do everything on your own. So what the study recommends is that try to delegate tasks that eat up most of your time, so you have the rest of the day to spend with your family doing things that you love. Overall, the article just recommends taking every opportunity you have to strengthen important relationships in your life for yourself and those you care about. And I'll just pass on to Dr. Kernu if you have anything you want to add.
No, I think you said it well. So the Harvard longevity trial shows that the number one predictor of how long you're going to live is the number of quality relationships that you have. And it brings me back to what I see in healthcare on 5 West. They have a team of 100 people that add quality. They work well together. They make it work, and they make it work for the patients. We thank you. Now make it work everywhere else.
Okay, so I'll be talking about the importance of maintaining social relationships and getting exercise, especially during these times. We're in quarantine right now, we're in lockdown, and getting out and meeting people is not really a suitable option most of the time. But that doesn't mean we still can't create and maintain meaningful connections with the people we love. And this is kind of a continuation of what Yuyen was talking about, the Harvard study. She was giving examples of the women in the marriages. Oh, sorry, my bad. And marriages and like the large study of the Swedish people over 75. So these show that there's very strong evidence that social relationships can affect almost every aspect of our life and health, to the point where it even acts as a sort of prevention method for certain illness, such as the dementia in the Swedish study. And this certainly and many other studies certainly back this up as well. There's other studies that show that having a social support network can help us cope in stressful situations, reduce cardiovascular risks, promote good mental health, promote healthy lifestyle behaviors, and encourage adherence to treatment plans, be it, sometimes it can be diet plans, it can be medication, it can be exercise, and these are just to name a few. There's definitely much more, benefits to having that social support system there with you. And especially now, social media and the internet has made it possible for us to keep in touch virtually, but sometimes just chatting with a family member for a few minutes or working together in the same room, you don't even need to talk sometimes. Just being there with someone, knowing that you're not alone I think, is a great way to spend time and know that spending time with someone in person or virtually to any capacity is a great way to maintain your social connections. And if it's safe for you to meet up, of course, in very small groups with friends or family, please make sure you're also following social distancing protocols. Next slide, please. So this is kind of like I'm going to like the exercise portion of it. So when and how we start exercise is going to be different from everyone else's. Everyone has a different starting point. So I think it's important to note that safety is always a first priority when engaging in physical activity. So starting an exercise plan takes a lot of motivation, a lot of determination. However, maintenance of that plan is also very crucial for long-term health. Personally, I think an exercise kind of routine can be broken into 5 phases, give or take. So the first phase would be planning it out. So when and where to work out and what type of workout. Is it going to be cardio? Do you want to do some body weight exercises, or is it just going to be, doing some chores around the house, doing some yard work, going on a walk, building up a sweat, getting your heart working. And the second phase would be the before workout. Warming up. This is a point on safety. Always be sure to work out before any kind of strenuous exercise, just to reduce the chance of injury. Warming up can help us get our blood pumping to our muscles, and as our body temperature increases, our joints loosen as well, meaning there's less stress on joints and tendons when we do exercise, which leads to a much more meaningful workout. The next phase would be to exercise, get our body moving, building up a sweat, and after exercise would come the cool down. I feel like many people tend to forget this part as well, but this is actually the perfect time to get a good stretch in, because our body, our limbs, our muscles, they're still warm from the exercise. By stretching, we can help reduce the tension and reduce cramping later on. This is also a great way to help us adjust our body back to that resting status, slowing our heart rate down gradually while keeping the blood flowing. And the 5th phase is recovery. Personally, I see this as kind of massaging, rolling out our muscles if needed, doing light cardiovascular exercises, walking, maybe doing some jogging, doing some housework, anything that'll get your heart beating a little faster, and this can help reduce soreness, speed up the muscle rebuilding process, and prepare us for our next, workout or our next round of exercises. Next slide, please.
So this is actually important to realize this, is that there are multiple benefits, and we won't spend more time than we need to say, but please look at all this stuff we provide our people as well. Is that, to me, exercise is a wonderful antidepressant. It's the best way of preventing or delaying Alzheimer's disease and to stay in your home longer. Next slide, please. So there's lots of information to look at that, and really important. You can look at this, and you've seen this before. It's real. Get a good pair of shoes and make sure it's safe. There's now good data that exercise for people that are frail, provided it's safe to exercise and that you address the issues about falls risk is really important, and it keeps you at home longer. Next slide, please. So much to say. Now, this is, so we talked about how exercise can build resilience. Working around people like on the 5 West Ward helps build my resilience by seeing other people by example. So who's going to talk about resilience here?
That would be me. So this is a really important section. I'll try to keep it brief, but what we really want to stress with resilience is that it's a process of adapting in the face of adversity, trauma, tragedy, threats, or even significant sources of stress, which a lot of us might be facing, especially now during this time. And with resilience, we really want to encourage you to surround yourself with people that make you better, people that are doing things, trying new things, and trying to be better, because having a strong support system is really at the base of being able to bounce back from adversity. Next slide. And so why is resilience so important, and how do we develop it? So first, it encourages us to stay productive and channel our energy into action. Second, it helps us maintain a balance, manage those negative emotions, stress, and pain. And three, it protects and promotes positive mental health and well-being, which can be especially challenging to maintain during this time. And so I think a really important point of resilience is to normalize failure, normalize trying new things, surrounding yourself with new people, and taking time for yourself. I know that it's very difficult, especially now with everyone working and having it very difficult to keep a work-life balance, but just trying new things and normalizing failure and reaching out to people to get better is definitely the first step, I think, for building resilience. Next slide. And I think optimism is also a strong pillar of resilience. It's the belief in a positive future. It's the engine of resilience, and it can have so many benefits. I know that it's quite difficult to stay optimistic once again during this time, but just a little bit of optimism, it can increase greater social support, increase relationship satisfaction, improve your quality of life. You're less likely to experience symptoms of depression. And on the physical side, optimism can contribute to a more robust immune system, less likely to have heart challenges, less likely to be rehospitalized, and more likely to live longer. So just some things to keep in mind during this time. Okay, so our last section is COVID-19 vaccine updates. Matthew's going to take it away, but just the slide that we have coming up is really important. Next slide. And so this is some COVID-19 data on cases and deaths in healthcare workers in Canada. And since we've dedicated this webinar to healthcare workers, we just want to say once again, thank you so much for everything you've done. You've truly put your life on the line for us. This data was taken, I believe, at the beginning of January in 2021 of this year. And so as you can see, there's over close to 700,000 cases of COVID-19 in healthcare workers and 65,000 deaths reported as of January. So I can only imagine things have gotten a bit worse up until now, but we want to encourage everyone to get the vaccine if you can. And so we're just going to talk a little bit about vaccines in this next section.
Yeah, so just wanted to give a brief overview of the vaccination history and kind of how it came to be. So the first vaccine was actually all the way back in 1796, where they infected people with cowpox, which was a more mild form. So that way when they got the real smallpox, it would be less severe and they wouldn't actually die from it. You can see from 1978 to 1981, measles cases fell by 80%. We eradicated polio, smallpox, and then rubella in 2004. So we can see that there's a long history of vaccines being very helpful in the fight for public health. So now, what does a vaccine do? Well, a vaccine will produce memory cells, which are a specific type of immune cells that will stay in your body after your initial infection. And what these do is the vaccine will create these without actually being infected by the virus. So it trains the immune system against that specific virus, and by doing so, it doesn't create as severe symptoms. And this is because a stronger and quicker immune response is built up. And as you can see on this little graph below, usually that where the vaccine is, that would be where you would first get infected, and then you would have this very low and very long primary immune response that takes a while to get going. But if you trick your system with the vaccine and create this immune response first, then once you get infected by the real COVID-19 virus, you can see that secondary immune response occurs much quicker and is much stronger than that initial primary. So this is the underpinnings of all the vaccines and why it's so important that we get them. Now I just wanted to go take a little bit of time to go through what the difference is between an mRNA and a viral vector vaccine. So you can see below the mRNA is the typical Pfizer and Moderna. So what they do is they take the SARS-CoV-2 antigen, which you can see here, which is on the surface of the COVID virus. And what they do is they take that and they extract and turn it into an mRNA copy of just that protein. So what they do is if you can click the next slide, they turn that into a piece of mRNA, which is almost like a recipe for how that protein is made. And what they do is then they take that mRNA, next slide, and they will inject it as a vaccine, putting a carrier protein on that. And what that will do is the mRNA will enter the cell. Next slide. The cell will then read that mRNA and produce those antigens, next slide, and release them into your body. And this will create these immune responses that create this immune response and produce these cells that are going to fight against the virus. So next slide. And then the next slide after that. So the body produces these antibodies and these memory cells that can remember this virus when it comes back in the future. Then the viral vectors use an adenovirus. So this is a normal and relatively inert virus. So they don't actually use a protein coat. They just use a regular virus. And they take the SARS-CoV-2 antigen, like we said before. Next slide. And what they'll do is they will inject the DNA of SARS-CoV-2 antigen that codes for that protein, and they will inject that into the inert virus. And what that will do is the adenovirus, the inert virus, will kind of act like a bus or like a shuttle, and it'll carry that into your body and bring it into the cells. Where in the cells, what it's going to do is it's going to, next slide, is it's going to do the same thing where it's going to enter the nucleus and tell your cells to produce that spike protein, and that spike protein will in turn create those antibodies and memory cells. On the next slide. Yeah, so you can see that that's just a general overview. Now go ahead, next slide. Now, what's with the 2 doses? So a lot of people have this question, and some are 1 dose, some are 2 doses, but the whole point of the 2 dose is that the first dose actually produces a relatively weak immune response, but with a second dose, it'll amplify that even more. So the first shot starts kind of building, and the second dose reinforces. So for example, as you can see here on the right, if you have 1 shot, it's just 1 person carrying that big, bed or package or whatever. But if you have that second dose, it reinforces and adds on to that response, making it even stronger. And this is actually very common in other vaccines that have shown to be very beneficial, including the measles, mumps, and rubella vaccine that we get, the hepatitis A and B, and the shingles vaccine, which are all 2 doses. So that's an interesting point. Now, the important thing, next slide, is where to get vaccinated. So there are several ways you can get vaccinated now. Recently, there's been an amazing amount of progress where I think 12 and older in some areas can get vaccinated, which is fantastic with their first dose. So you can go to participating pharmacies. So for example, Costco, Shoppers, Rexall, Walmart. You can find a list of them just by searching on Google. Some primary care physicians will actually contact you if you're eligible, which most people are now. And there's also vaccine clinics, which you can book through either the provincial portal, which you can find online, or through your specific city, depending on whether or not you have an Ontario healthcare card or if not. But really, if you have any questions about that, a quick search on where to get your vaccine on Google will be very, very helpful to help you out with that. So next slide. So yeah, the goal of that is just to say, let's all get vaccinated. The whole point of this presentation was to thank the healthcare workers for everything and all the amazing work that they're doing. And what we can do is, by getting vaccinated, really help to prevent those severe hospitalizations and really overstressing the healthcare system. So let's try to get our vaccines. Dr. Kearney, do you have anything else to add?
What I find truly remarkable is that in a span of 1 year, hundreds of thousands of people have been involved in clinical trials. And to find multiple vaccines that are 90% effective at decreasing need to be in the hospital, being on a ward like 5 West, or dying from COVID. So I'll repeat that. These vaccines, all of them, are 90% effective at decreasing hospitalization and need to be need to be on a respirator, being hospitalized, or dying from COVID. That is truly amazing. Very few things in healthcare are that good. Now, Can things go wrong? Absolutely. What's truly remarkable too is that when the AstraZeneca vaccine came out, within the space of a number of months, very smart physicians and healthcare teams discovered that you can develop an antibody to platelets that we knew about that was caused by something called heparin in the past or other viruses. And there are treatments for that. So we know that the risk from AstraZeneca's vaccine is somewhere between 1 in 50,000 to 1 in a million people will get this strange blood clot abnormality. On the other hand, is that you have a vaccine that's 90% effective at decreasing hospitalization or dying from COVID. What a trade-off. So to me, what is the best vaccine? The one you can get first is really important. Now, this is a picture here at Shoppers Drug Mart right next door to us. There's my son, who is 23, who's had a challenging year because he's finished university. He's in outdoor recreation. He can't get a job. Here's a friend who I played tennis and squash with for a while and had trouble navigating the system and able to point him in the right direction. And this is Rami's staff here that gave the jab. Now, I'm very grateful. I'm very grateful for Big Pharma for coming through, for developing the vaccines. Well researched. The FDA, Health Canada has spent a lot of work trying to figure out who to vaccinate and when and how to do this. And you can see the rules are changing all the time because the science changes all the time. So I'm proud that people are paying attention. But to me is that there are two reasons to get vaccinated. One is to protect yourself, and for many, such as my son, is to protect others. You heard Lisa's story where, without knowing, she spread the virus to her dad. Her dad died. Now, that is not Lisa's fault. That's nobody's fault. It would be people's fault and one of the things that was important to me is to get fully vaccinated because I deal with high-risk people. And there are many times you sneeze or cough the wrong way. Do I have COVID? And more importantly, am I going to spread to somebody and hurt somebody? So to me, the number one reason why, because we all think we're invincible. I'm not invincible. And walking through a COVID ward, you see a 30-year-old individual who's skinny, who's struggling for their life. And what are they doing there? I walked through the intensive care unit one day, and it looked like there was a 20-year-old young individual who struggled for her life on a respirator. She's been there for a long time. She shouldn't be there, but she is there. Now, the disease, is that 70% of the disease is if you're overweight, so body mass index over 23. And one of the things that we spent a lot of time talking about, exercise, resilience, and doing something about that. So my plea to everybody is to really work hard on treating the risk factors. One is weight, which is a hard thing to do. Knowing your blood pressure, diabetes, these can change outcomes. And what happens is that, so keep working on that. I'm not saying it's going to be easy. Zoya has helped me over the years and others about becoming more resilient. And I think I become more resilient because of the crew on 5 West. Seeing what they're doing on a daily basis is powerful. Knowing that there's someone that has your back if you get sick is very reassuring and doing very caring. Some days I can do a good job and some days I want to cry. But my plea to everybody is to get healthier, to get better. Most of us have about 50 to 80,000 thoughts that go through our heads a day. Most of them are unpleasant, repetitive. So I'm grateful, and every day I'm grateful that I can still go to work, to see great people do great things in healthcare, and to see all these young people here making us all better. So I'm grateful for that. I have Rami here. I have a team of people, and I have a wonderful crew in my office that I appreciate. Yes, we're scared at times, but you know what? You miss 100% of the shots that you don't take. Wayne Gretzky. So take your shots. 1 is in your arm, maybe 2 in your arm, but also take shots of helping others and making the world better. And truly, this is a remarkable time. I'm very proud of the team on 5 West and played a small role. And thank you so much for all you've done. Next slide, please.
So this is just a graph of Canada showing how many of us have already got our first dose of the vaccine. We really want to fight vaccine hesitancy, so feel free to contact our clinic if you have any questions about the vaccine, but please, if you can and are able to, go and get the vaccine. Next slide. So that wraps up our presentation. We wanted to say once again, thank you to healthcare workers. You've chosen selflessness over self-preservation, not just today against COVID-19, but every time you step into your workplace. And so we are incredibly grateful to be in your presence and so grateful for everything that you do for us. And I think our last slide is just a thank you video.
So I'm going to just start it now. So 3, 2, 1, and go.
I just want to say thanks to each and every one of you for your support and going out of your way. We can't make this without you, without everybody's effort. Anyway, and everybody's understanding, because everybody's in a different situation, different locations, and everything's understanding. That's basically what we have to do, give and take.
Perfect. That was awesome.
Well done.
Thank you all so much for your signs and being here today and turning on your cameras. That's awesome. I think we'll be releasing this video, so I'm going to just start it now.
So that's Jerry and his team who are part of our, we call it the 3Ms. These young people every Wednesday at 7 o'clock, resilience, exercise, meditation. They've done a wonderful job, and this is one of the recordings from last week. And then, on Tuesdays, we have the weight loss crew on Zoom. And who else? I didn't know what the word Zoom was before a year ago. But I sure as hell know what that word now is. And I sure know a bunch of really resilient people. It doesn't mean everybody has done that, from the people in the supermarkets, the people in Mr. Subways, the people that serve us. I feel like a gratitude for everyone to just how hard they've worked and tried, and to our families who have given us the chance to work hard on this and sacrifice. And again, thank you everyone on 5 West and everywhere else. And that's one of many MASH units out there. Thank you. Are there any questions or thoughts from anybody at all? Any thoughts that we forgot to bring in, or people, any comments? Anybody on YouTube, any questions there, Stuart, at all?
I think we had a question about just the chemical composition and strength of the first and second dose. But yeah, they for both Moderna and Pfizer, those are the same dosage and the same composition for the first and second dose. The second dose is just a booster of the first dose, so they're the same.
So it's very interesting about vaccine development. So most vaccines of the world are called prime and boost. So the first dose primes your immune system, gets it working. And it looks like the Moderna and Pfizer vaccine are 70% effective starting about 2 weeks after their first dose. And you get to 90% effective at decreased hospitalization after the second dose. And for most vaccine developments is that the second dose, delaying the second dose gives you extra protection. And one of the thinking is that how good are they at preventing infection, and do you need 2 doses or not for that? So we're learning all the time. I'm a simple cardiologist who's learned a lot of immunology over the last years, and the more I learn, the more I still have left to learn right now. So I think the strategy that Canada has adopted is to get as many people vaccinated first, and delaying the second dose is not unreasonable. It goes a little bit against how the trials were done, but that's different interpretation. So I'm so glad that people out there trying to get us doses, and I'm glad that we'll be able to hopefully provide doses to other places too as well. Any other questions out there?
Dr. Kernu, I have a question. It's Lisa. Seeing I've had COVID and I've also had my first injection of the vaccine, I received the Moderna. So basically, I've had 2 injections already, and my second injection will be really my third.
Yeah, it's very interesting. So first of all, my first thought is that people want to get their immunity naturally. What we know about vaccines is vaccines provide better immunity than the disease. I would have thought the other way around. I thought by getting sick, let's say from COVID and recovering, I'd be super strong. But that's why like shingles. Shingles is basically a dormant virus. It's a chicken pox, and when we're younger in life, we get chicken pox. But the virus stays in our body, reactivates later in life. So right now is that you get better immunity by the vaccine. So you need at least 2 doses, and whether or not you need. So your first dose was having COVID. The second one was the vaccine, and right now the wisdom is to get fully vaccinated. But you know what? We're still going to learn that question right now. So if I were in your shoes right now, I would get fully vaccinated, and you'll probably have extra immunity potentially. But 90% after 2 doses is pretty darn good right now. Now the question is, what is going to happen to the virus? How is it going to change over time? And that's why there's this great urgency to get vaccinated now, because the virus, as you can see, is mutating. It's going to change. So we want the virus to go away, and there's 2 ways for the virus to go away. If each of us stay in one place for about 2 to 3 weeks and not talk to anybody, the virus is dead. We're not willing to do that as a society. Second is natural immunity. That's going to take probably 20, 30 years, and the virus will mutate, and we have influenza every year that comes back. Look at influenza this year; it's gone, and it's gone because of the hygienic measures that people put into place. And so for us to move on in countries that get properly vaccinated, the virus seems to go. And what's going to happen next year, next month, I don't know. But I'm sure glad that we have science to help guide therapy and to guide the future right now. So my advice to you is get, after COVID, getting 2 doses of vaccination at this stage. And we still have lots to learn. Great question. And thank you for sharing all your thoughts and your family. You're a wonderful family.
Thank you.
Stuart, and do you have any final thoughts? Stuart is one of these people, reminds me of Jen. Jen is in my office, is behind the scenes. She just does things without asking for thanks, and I thank them. Same thing with Stuart. Stuart has put together over 200 videos. He took over and has brought this up to a new level. And so, Stuart, you deserve a special thanks. And when COVID came, you came out with Paul and the rest of the team to make these wonderful videos. So we thank you for that. And maybe we'll get shorter on these videos, but there's so much to say and to be thankful for. Stuart, what's your final thoughts?
Oh, I appreciate the kind words. It's very sweet of you, but really all the credit goes to the incredible volunteers that I have working alongside me and supporting. So it's a big team here. The credit doesn't go to one person, the credit goes to everybody. We had some new volunteers who joined us today. They spoke very articulately, very clearly, and it was really nice to have some fresh faces on the webinar. For some of the more experienced volunteers, again, you did a phenomenal job. So I always like to start off by thanking you for your contributions each and every week. You did a fantastic job. But of course, today's webinar is all about thanking our frontline workers. I never like to speak on anyone's behalf, but I know I don't speak for just myself when I say that your courage, your enthusiasm, your empathy is truly remarkable. It's truly inspiring. I've had the privilege now of being a COVID screener in my local hospital. And every day I see staff come in, I screen new staff, and most of them have a smile on their face bigger than my own. And I know that they're coming into the hospital, and their day is, way harder than mine has been, and way harder than my day will be, right? But they have a bigger smile on their face than me, and it's just a testament to their strength, their resilience. I know it's incredibly hard times for everyone, but it's truly inspiring and truly motivating to see that. And I know that this webinar, despite our best efforts, will never do justice to the contributions that you've made for the past year and will continue to make for years to come. But we just wanted to give you a small token of gratitude and a small token of thanks for all your efforts and your hard work. So I think that's my takeaway for this evening. So thank you very much.
Again, on behalf of all of us, Rami, do you have any final thoughts?
First of all, thanks again for all the time and efforts done by all the healthcare workers, whatever they are, all the first frontline workers, whatever they are in every place in Canada. I also extend my gratitude and for the fact that I am actually working very close with Dr. Cornu and his great students who are really doing a lot to behind the scenes to produce such a great example of education, because I think that when at any workplace, if we continue having lifelong learnings, that's by itself is a huge motivation. So wish everybody the best and for them and their families, and I hope that we will always see you guys, and hopefully at one point we will go back and do those clinic education sessions that we used to do before COVID with Dr. Cornu, which was great.
Again, on behalf of everybody in the community, we thank all those MASH units, all those frontline workers. Thank you for what you've done.
Thank you so much. Good night, everyone.